What if the very pill you take daily for your blood pressure is quietly causing your swollen ankles, dizziness, or even muscle tremors without you ever knowing? Did you know that nearly 1 in 4 people who take Amlodipine, or Norvasc, end up feeling side effects they never expected? Some of these effects are so subtle that you might not even realize they're linked to the medication itself. Amlodipine is taken by more than 50 million Americans, making it one of the top 10 most prescribed medications in the country. For decades, it's been the go-to treatment for high blood pressure and chest pain, thanks to its effectiveness as a calcium channel blocker. But here's the thing. Understanding the full range of potential side effects is crucial, whether you're currently on it or considering it for your treatment. It's not just about knowing what to expect, it's about making sure you're fully informed and empowered to take control of your health. If you're taking Amlodipine or thinking about it, let's make sure you know the ins and outs of how it might affect you, both the expected and the surprising. After all, your health journey should always come with clear insights and good conversations. What if I told you that focusing only on lowering a blood pressure number might be leading many seniors to quietly experience unexpected dizziness, swelling, or changes in balance without connecting it to their daily pill? And that simple, everyday fruits and vegetables can play a powerful role in supporting your body through these changes? Stick with me, because the story of my 85-year-old patient, Martha, who worked with her doctor to truly understand her body's full picture while on Amlodipine, will change the way you think about prescriptions and your health. I know what many of you might be thinking. Side effects are rare, and if they were serious, my doctor would have told me everything I need to know. While healthcare providers do their best to inform patients, the reality is that clinical consultations are often brief, and the full spectrum of potential effects, from the common to the uncommon, from the immediate to the long-term, doesn't always get the comprehensive discussion it deserves. Today, we're going to examine the complete landscape of Amlodipine side effects, backed by clinical data, and then discuss how common, accessible foods can support your body's well-being. Please note, this video is for informational purposes only and is not a substitute for medical advice. All information provided has been carefully verified, and source links are available in the description. Always consult your healthcare provider before making any changes to your medication or health regimen. Before we dive into these crucial insights, if you're new here, welcome. We're thrilled to have you on this journey to better health. Don't forget to hit that like button and subscribe so you never miss our upcoming content, and let us know in the comments how old you are and where you're watching from. We love connecting with our wonderful community. All right, let's get started. Understanding potential Amlodipine side effects, a closer look. Amlodipine starts working on day 1, but it may take 5 to 7 days of consistently taking it before the medicine reaches a steady level in your body. It's crucial to take it as directed, at the same time every day, with or without food. If it upsets your stomach, try taking it with food. Now, let's explore some common and less common side effects. 1. Dizziness. This is a common complaint, especially with higher doses or when you first start treatment. It can feel like lightheadedness or unsteadiness. You might particularly notice it when transitioning from lying or sitting to standing, a phenomenon called orthostatic hypotension. So, what can you do? Move slowly when changing body positions. If you feel dizzy, sit or lie down until the feeling passes. Ensuring you drink adequate fluids throughout the day is also crucial, as dehydration can significantly worsen any dizziness you might experience. If dizziness persists, it could mean your current Amlodipine dose is too high, or other medications you're taking need to be reviewed and possibly adjusted. And, of course, avoid alcohol, as it can increase drowsiness and dizziness. 2. Edema, swelling. Swelling, particularly noticeable in the legs or ankles, is medically termed edema and stands as one of the most common side effects associated with amlodipine. This swelling occurs because amlodipine's primary action is to dilate or widen your blood vessels. This beneficial widening can sometimes put increased pressure on smaller blood vessels, capillaries, causing fluid to leak into surrounding tissues, most commonly manifesting as visible swelling in both legs. The likelihood of edema is generally greater for individuals taking higher daily doses. Interestingly, clinical trials show women were approximately 2 to 3 times more likely to report swelling compared to men. 3. Weight gain. Amlodipine. As a medication does not typically cause weight gain in the sense of increasing body fat directly. However, you might observe an increase on your weighing scale if your body begins to retain more fluid, as we just discussed with edema. Here's a crucial point. For individuals with pre-existing heart failure, any noticeable weight gain, especially if it happens rapidly over a short period, can be a cause for significant concern. It could signal that your heart isn't pumping as effectively. Therefore, it is extremely important to report any rapid or significant changes in your weight to your healthcare team while you are taking amlodipine. 4. Angioedema. This is a specific and potentially serious type of swelling that can occur, albeit uncommonly. It usually affects areas like the face, lips, tongue, or throat. Because angioedema can involve the upper airway, it carries the potential to be life-threatening if the swelling becomes severe enough to obstruct breathing. If you experience any sudden swelling of your face, lips, or tongue, or encounter difficulty breathing or swallowing while taking amlodipine, it is crucial to seek immediate emergency medical attention. 5. Fatigue. Some individuals taking amlodipine may find that the medication makes them feel unusually tired or fatigued. This sensation of weariness can sometimes impact one's ability to carry out daily activities effectively. Unlike certain other side effects, this feeling of fatigue doesn't seem directly related to the specific dose you are prescribed. Your body often requires an initial adjustment period to get used to the new medication. The positive aspect is that this medication-induced fatigue may improve and lessen over time as your system adapts more fully. 6. Flushing. This manifests as skin, often on the face, neck, or upper chest, looking noticeably red or feeling uncomfortably warm. This is a direct consequence of amlodipine's primary action, the widening of blood vessels. The likelihood of experiencing flushing increases with higher doses. Interestingly, clinical trials suggest women were approximately 3 times more likely to report experiencing flushing compared to men. 7. Palpitations. A sensation of a fast or irregular heartbeat, commonly referred to as palpitations, is another possible side effect. You might feel as though your chest is unpleasantly pounding, fluttering rapidly, or even feel like your heart is skipping beats. During clinical trials, women were noted to be more than twice as likely to report experiencing palpitations compared to men. This particular side effect also appears to be more likely to occur with higher doses. While often benign, palpitations can sometimes be a sign of a more significant cardiac concern that warrants medical evaluation. 8. Nausea or stomach pain. Many medications can cause gastrointestinal upset, and amlodipine is no exception. Some individuals may find themselves experiencing nausea or stomach discomfort, though these symptoms are usually mild. If you find that you are feeling nauseated after taking your dose on an empty stomach, you might try a simple adjustment. Consider taking the medication with a meal, or at least a small snack. This can help buffer the medication's contact with the stomach lining and potentially reduce irritation. 9. Low blood pressure. Hypotension. The possibility of experiencing low blood pressure is an inherent consideration with any medication designed to treat high blood pressure. The likelihood can increase with higher doses, or if you're taking amlodipine concurrently with other blood pressure-lowering medications. Common symptoms include blurred vision and a general feeling of lightheadedness or dizziness. More serious symptoms like a noticeably fast or irregular heart rate, sudden confusion, or fainting, syncope, require immediate emergency medical care. 10. Muscle tremors. While considered uncommon, some individuals reported experiencing muscle tremors, involuntary shakiness, or rhythmic quivering during clinical trials. Other related musculoskeletal side effects like stiff muscles and various types of abnormal muscle movements have also been reported. If you notice the onset of shaky or stiff muscles or any unusual changes in muscle control or movement patterns while you are taking amlodipine, it is very important that you report these observations to your prescribing healthcare provider right away. It's also vital to be aware of what can interact with your amlodipine. For instance, grapefruit juice has a chemical that can interfere with the enzymes that break down amlodipine in your digestive system. Too much of this fruit can actually worsen your side effects by increasing how much medicine you have in your body. Always ask your healthcare team how much grapefruit is safe for you. You may also want to avoid St. John's wort, as this herbal supplement may impact how amlodipine works. Certain medications can also interact and raise your risk of side effects. These include clarithromycin, cyclosporin, diltiazem, itraconazole, simvastatin, and tacrolimus. This is why it is absolutely critical to give your healthcare provider a complete list of all the medicines, herbs, non-prescription drugs, or dietary supplements you use. They need to know the full picture to ensure your safety and the medication's effectiveness. Supporting your body with everyday foods, a gentle approach. While you must always discuss your medication and any side effects with your doctor, certain common, accessible fruits and vegetables can play a powerful role in supporting your overall well-being and potentially help alleviate general discomforts that sometimes coincide with or are worsened by specific side effects. This is about nurturing your body and optimizing its natural functions, complementing your medical care. 1. For swelling, edema, and general fluid balance, celery. Think of it as nature's most balanced natural diuretic. It gently stimulates kidney function to remove excess sodium and water, helping to reduce that uncomfortable puffiness in your legs and ankles. My advice? Eat it raw with almond butter, chop it into soups, or juice it with cucumber and lemon. Pineapple. This tropical fruit contains bromelain, an enzyme that reduces inflammation, improves circulation, and eases swelling by breaking down protein debris in your bloodstream. It's also over 85% water, excellent for hydration and lymphatic drainage. My tip: choose fresh, raw slices and try eating the core. That's where the highest concentration of bromelain is found. Cucumbers. These are loaded with silica, a mineral that helps stabilize your body's collagen, and they're wonderfully anti-inflammatory and hydrating. They help flush out excess sodium that contributes to swollen legs and fluid retention. The trick? Eat them unpeeled and raw, perhaps with a dash of lemon or apple cider vinegar. Parsley. This humble herb is actually a powerful natural diuretic, gently encouraging your kidneys to remove excess sodium and water. It also contains flavonoids that strengthen capillaries, crucial for preventing fluid leakage into tissues. Add parsley into your soups, blend into green juices, or chop it fresh over warm meals. Beets. These vibrant roots increase nitric oxide, a compound that widens blood vessels and improves circulation, which is critical for reducing pressure and swelling in your legs. Their betalain compounds are powerful anti-inflammatories. You can roast them, shred them raw into salads, or blend them into smoothies. Avocados, rich in oleic acid, which calms inflammation, and packed with potassium to help flush out excess sodium responsible for water retention and swollen legs. My patients often enjoy a few slices daily in salads, on sprouted grain toast, or blended into smoothies. 2. For general energy and vitality, and combating fatigue. Whole grains. Foods like oats and brown rice provide stable, slow-release energy, preventing the blood sugar spikes and crashes that often contribute to fatigue. My recommendation? Start your day with a bowl of whole oats or use brown rice as a base for your lunch. Antioxidant-rich fruits, blueberries and strawberries are packed with antioxidants that fight cellular damage and inflammation, which can drain energy. They also offer a natural sweetness without the glycemic spike. A handful of blueberries in your morning yogurt or sliced strawberries with nuts as a snack are fantastic choices. Healthy fats, walnuts, chia seeds, and extra virgin olive oil are rich in omega-3s and monounsaturated fats. These reduce inflammation and support overall cellular function, directly impacting your energy levels. Sprinkle chia seeds on your breakfast, enjoy a small handful of walnuts as a snack, and drizzle olive oil over your vegetables. Friends, understanding these potential medication side effects and proactively supporting your body with common, accessible foods isn't about fear. It's about empowerment. It's about having an informed conversation with your healthcare provider about your complete health picture. You have more agency than you think. Let me tell you about Martha. Martha, at 85, had been taking Amlodipine for her high blood pressure for several years. While her blood pressure numbers were excellent, she started experiencing persistent ankle swelling that made her shoes tight and her legs feel heavy by evening. She also noticed new episodes of dizziness, especially when she stood up quickly, which made her nervous about moving around her home, and she was suffering from subtle muscle tremors that she initially attributed to just getting older. She hadn't connected these frustrating issues to her medication. After learning more about the potential broader impacts of amlodipine and the power of supportive foods, Martha gathered her notes and bravely went back to her doctor. She courageously asked specific questions about her swelling, dizziness, and tremors in relation to her medication. Her doctor, appreciating Martha's proactive approach, reviewed her case. Together, they decided to carefully adjust her amlodipine dosage, seeking the lowest effective dose to control her blood pressure while minimizing potential discomforts. Simultaneously, Martha eagerly integrated key foods into her routine. For the swelling, she focused on including more celery, pineapple, cucumbers, and parsley into her snacks and meals. For the dizziness, she made sure her daily fluid intake included foods like avocado and thoughtful sips of water. For her energy, she prioritized whole grains like oats and antioxidant-rich berries. What happened next was genuinely transformative. Within a few weeks, Martha's ankle swelling significantly reduced. Her shoes fit comfortably again. The episodes of dizziness became much rarer, and she started moving with greater confidence. She even noticed a subtle but definite reduction in her muscle tremors, leading to steadier hands. While her amlodipine was still necessary, the adjustments to her medication, made in collaborative conversation with her doctor, combined with her new dietary habits, allowed her to achieve her heart health goals with far fewer discomforts and a much improved quality of life. "It's like I have my comfort and my freedom back, doctor," she told me with relief, with a radiant smile. Martha's story is a powerful testament that it's never too late to advocate for your health. It's never too late to ask informed questions, to understand the full picture of your medications and to work collaboratively with your doctor to find the best possible balance for your unique body. You have more agency than you think. If you're taking amlodipine or any medication and have experienced unexpected symptoms, please bring this information to your doctor. Have an open, honest conversation about your concerns and explore all your options together. Your body deserves to be understood. I'd love to hear from you. Have you experienced any surprising side effects from medication that prompted an important conversation with your doctor? Share your story in the comments below and let us know your age and where you're watching from. Your experience could inspire someone else, just as Martha's inspired me. If you found this video valuable, please give it a like and share it with someone who needs to hear this message of hope. Until next time, take care, stay informed, stay active, and keep investing in your healthiest, most vibrant self.